More than 1,000 years ago, an ancient Persian medical text advised for the treatment of hypertension lifestyle interventions such as avoiding meat and pastries, and recommended eating spinach. 1,000 years later, researchers discovered that a single meal containing spinach could indeed reduce blood pressure, thanks to its nitrate content. All green leafy vegetables are packed with this stuff, which our body can use to create nitric oxide that improves the flexibility and function of our arteries, which may be why eating our greens may be one of the most powerful things we can do to reduce our chronic disease risk. Just switching from low-nitrate vegetables to high-nitrate vegetables for a week can lower blood pressures by about 4 points. And the higher the blood pressure they started out with, the greater benefit they got. 4 points might not sound like a lot, but even a 2-point drop in blood pressure could prevent more than 10,000 fatal strokes every year here in the U.S. Potassium-rich foods may also act via a similar mechanism. If we just got the minimum recommended daily intake of potassium, we might prevent 150,000 strokes every year, because potassium appears to increase the release of nitric oxide. 1 week of eating 2 bananas and a large baked potato every day significantly improved arterial function. Even a single high-potassium meal, containing the equivalent of 2 to 3 bananas worth of potassium, can improve the function of our arteries. Whereas a high-sodium meal, which is to say a meal with the regular amount of salt most people eat, can impair arterial function within 30 minutes. Whereas potassium increases nitric oxide release, sodium reduces nitric oxide release. So the health of our arteries may be determined by our sodium to potassium ratio. 2 slices of bacon worth of sodium in our arteries take a significant hit within 30 minutes. But add 3 bananas worth of potassium, and you can counteract the effects of the sodium. When we evolved, we were eating 10 times more potassium than sodium. Now the ratio is reversed, more sodium than potassium. These kinds of studies provide additional evidence that increases in dietary potassium should be encouraged. What does that mean? More beans, sweet potatoes, and leafy greens, which are like a super good double whammy, high in potassium and nitrates. This recommendation to eat spinach from the 900s, pretty impressive, though they also recommended bloodletting and abstaining from sex. So we should probably take ancient wisdom with a grain of salt, but our meals should be added salt-free.
Hi, I'm Dr. Victor Dolan, and this is Good Health Naturally. With me is my friend Brittany, actually one of my puppies. How you doing, Brits? Okay. Almost 15 years old, and puppy dogs, like humans, need good health naturally. And Brittany gets a great diet, and we of course participate and utilize her veterinarian very heavily, but she's not on any medications. She's on a ton of vitamins, just like many human beings. She used to be a competitive agility dog. Now she's retired and a champion, and Brittany gets adjusted and gets vitamins. And Brittany is a good girl because she's a pet therapy dog. She's been in hospitals and nursing homes being therapeutic to the patients there, especially our older seniors in nursing homes. It brings them out of their shells, picks up their moods, when they see a nice pretty girl like Brittany. Now Brittany, through the years, being a competitive jumper, she has some arthritis. And just as humans, I recommend glucosamine sulfate, chondroitin sulfate, SAMe, S-A-M-E, MSM, different supplements for human beings. I also recommend supplements for our puppy dogs and not so puppy dogs. Brittany does a lot better when she's on glucosamine. Unfortunately, sometimes we've neglected to give her glucosamine and things change. She gets a little tender in her rear end here. She has a little difficulty walking around. We started with the glucosamine again, and glucosamine helps her a real lot. Now she's about 70 pounds. The glucosamine that she gets is about 750 milligrams in the morning and about 750 milligrams in the evening. For human beings, 150 pounds, 1,500 milligrams is what we need to stay asymptomatic. She's kind of getting a double dose because she does have arthritis. You can use glucosamine for your dogs or other vitamin supplements. Of course, always talk to your veterinarian, but you can use vitamins for your dogs, and you have to titrate it to their weight. If they're a big dog, 200 pounds or more, they can take a human dose. If they're a little 10-pound dog, then you have to take a much smaller amount. Most vitamins are based on 150-pound humans. So if you have a 10-pound dog, you're looking at taking 10% or less of a human dose. If you have a 70-pound dog, you're looking at taking about half a dose of what a human gets, unless they already have some sort of illness or disease process that you're trying to find, always in concert with your veterinarian. Now, Brittany's getting some pets. We're going to take a break in the video because I'm going to set her upright, and I'm going to show you how we give her an adjustment. Brittany takes adjustments too, again in concert with her veterinarian's approval. You ready, Fritz? Now we know Brittany has some arthritis in her lower back, and we've seen her with adjustments and without adjustments. So I try to keep her in adjustment. I bring my tools home at night. I use a cold laser on her. She gets supplements just like a human being. And again, in concert with her veterinarian, this is the adjustment, the manipulation to her low back to help put motion back into her spine. You can see she's pretty comfortable with it. When she's hurting, sometimes you can see a little bit of a skin reaction. But you mobilize the joints down here, and then she gets up and moves much more freer. The winter's been tough on her, and when she gets adjusted, she moves better, she feels better, she's less lethargic, and she gets up quicker. So I try to keep her in adjustment. She's my dog, one of my little loves, so I try to keep her in shape by adjusting her in the cold winter, once or twice a week, and give her glucosamine and her cold laser therapies. She's a good old girl, and we're keeping her as healthy as we can. Keeping her healthy through good health, naturally.
Well, I found the segment where Dr. Oz and his father-in-law, Surgeon Jerry Lamole, have prescribed using colloidal silver as a holistic way of getting rid of sore throats and other ailments. And so I'm going to post that here in just a second. But in that clip, they're going to be showing you, a bottle of colloidal silver that you can get at the health food store for $15, which is actually mostly an ionic solution. That's what I want to explain is what Dr. Oz is going to show you is a clear ionic solution, and they're always kept in a brown bottle so it won't disassociate with the oxygen and create other issues. But the ionic, which is in the brown bottles, is mainly used for cuts, eye infections, sinus infections, basically a low chloride environment. You can still drink it, let it get in the bloodstream, but if you're trying to do something internally, that's where you want a true colloidal silver, which is more of an amber. Basically what this has been done is all generators make an ionic solution, 95% ionic solution, which is basically atoms that are missing one electron. So when you make a true colloidal silver, you're adding free electrons to the silver ions, which are making a larger silver particle, which is not affected by the hydrochloric acid in the stomach, and so it won't break down into a silver chloride. And so it's much more effective going into the system as a colloidal silver, which is in the clear bottles, because this does not break down in ultraviolet rays like the silver ionic solution. So just to keep that in mind, ionic is clear, it's in the brown bottles or blue bottles, and the true colloidal silver, it can be kept in the clear and is used internally. Or with a nebulizer. But it doesn't hurt to use the ionic internally. It's just, it's greatly reduced in its effectiveness, but still does work wonders. So without further ado, here is a segment with Dr. Oz saying his household uses colloidal silver, as well as his father-in-law, Dr. Jerry Lamole.
I would love for you to share some of your favorite holistic cures, things that I know that folks are using all the time in the Lamole household.
There's a couple of things. I think that colloidal silver is an antibacterial, antifungal, antiviral, and it's really good stuff for if you feel an oncoming sore throat or even a wound. You can spray it on your wound or like that. Got you.
You missed on purpose. Come on, terrible. My nose.
And that's a real good product. And then the probiotic is very important. These are normal, healthy bacteria that you should have in your body, but because of the antibiotics we take, the processed foods we eat, the diet, what have you, we get unhealthy bacteria in our gut. Mm-hmm. And actually, not only does it help, probiotic help with digestion, but it actually can make you lose weight, because they've done studies that showed that healthy bacteria in your intestine actually can help you lose weight.
And again, in the Lamole household, when you're not, if you have a sore throat, you're getting the colloidal silver spray in your throat first. That's the first thing they do. Probiotics again, malaise, intestinal issues. That's where I saw much of this. It was amazing to me. You could build wellness tools into your general lifestyle, which I'd never seen in my own personal life.